Hey guys, welcome back to online and dental education for general dentists and young resident, also dentists or dental assistant, dental hygienist, or uh, patient general population. If you are interested in learning about braces, feel free to make comment below and follow me and follow this YouTube video channel. I just want to show you this case, the case where the patient have a lot of crowded on the bottom teeth, not so much on the top. But this is something that if you're working in the area where very far from an orthodontist, yes, a general dentist, if you take the education and training, you should be able to fix the bite for the patient. In this case, they have a deep bite, and how can you go from that kind of shy smile to this confident smile? Well, yes, very simple. Dentistry, orthodontists nowadays getting better and better with the wide, the technology that we have. The what we call is a nickel titanium wire, night tie wire. It does everything for a dentist. So once you put a bracket, you know where to position the center of the crown part. The teeth will be straight at the several months later, it's getting straight because of the night tie memory wire. It will go back to original shape, and that's where the original shape is supposed to be a straight and ovoid shape. As you can see that the upper on the left case, that the upper on the right side is the ongoing finish, and the lower on the left, and then the lower on the right. And you can see there's great improvement how straight it is because of nickel titanium wire. It's not that nothing fancy from the dentist point of view. As long as you know, like I said, where to place the brackets on the teeth, the patient will have a straight teeth. It's not rocket science, and make sure that you have the concept and understand it. Take the class to learn how to do this. But I'm sure as a general dentist, you can handle this. You see the technology changing so much, and you can see now how much improvement and so many way of doing orthodontics. You still can fix the case. If the patient miss out a couple of months or thing like that, it's very, very interesting. As you can see, I start from top and you go down month 1, month 2, expanding and rotating the tooth and create room. All of these things called mechanical aspect in orthodontics. It's not rocket science, like I said. It's really interesting, and if you love what you're doing, you will enjoy it. So you can see from there to the one on the right, and then on the bottom, a lot of improvement. Again, you can see that upper tooth slightly crowded, lower teeth very crowded. Yeah, it doesn't matter when God create a beautiful way of putting the two art together. As long as you unravel the bone, alveolar bone, and it's fit together, you can see it. Thank you guys. Thank you for watching. I hope that you learn something and give yourself confidence. Take the class, get it, do it. You'll be excited to learn a lot more of your skill. And as you can see, this is the final. I hope you like what you see. I haven't completely done, but I'm going to post the final picture. But pretty much you can see where it coming from and how it's going to be. Patient are very, very happy. Smile. Thank you for watching again. Have a great day, everyone.